I'm Jamie, I'm one of the vets here at Australia Zoo, and today I've been called out in an emergency to see Tiffany, one of the red kangaroos. I rushed out to see Tiffany and could see straight away that there was a significant amount of swelling to one of her arms and she was not able to use her hand at all. And I was really worried. Having a fracture or a broken bone is a very bad injury for anybody, and it is especially bad for kangaroos. For pets, cats and dogs, they can stay in hospital until they heal, but unfortunately for kangaroos, staying in hospital is not an option. Because she needed to go straight back into her habitat, it was not going to be safe for her to wear a cast. We needed to go to surgery. Dr. Nima is one of the specialty surgeons at North Coast Veterinary Hospital, and she offered to see Tiffany straight away. Getting Tiffany to North Coast Veterinary Specialists was a big job. First of all, we needed to sedate Tiffany so that we could provide pain relief and apply a temporary splint so that we could stabilise the fracture and pop her into a transport crate to get her to the hospital. Once we were there, we needed to give Tiffany an injection of anaesthetic to make sure that she was completely anaesthetised for her surgery. And we took some x-rays that confirmed she did have a serious fracture in her arm and that she needed to have surgical repair. The surgeons used the x-rays to take special measurements so that they knew exactly how big the bones were and what size plates and screws they could use to repair the fracture. It was great to see all of the team at North Coast so excited to have Tiffany on site. They normally treat dogs and cats, but to have an Australian red kangaroo in there was a very different day for them, especially one of their staff members who is actually from the States, and she was incredibly excited to see an Australian native animal in the hospital. With any surgery, we want to make sure that we don't have any risk of infection, and this is especially the case with orthopaedic surgeries. If we get an infection in the bone, it can be extremely serious. So we take lots of precautions, including shaving all of the fur away from the surgical site, making sure that we sterile prepare the area with special antiseptics and that we clean away as much debris as possible. It also involves the surgeons and assistants and anaesthetic team wearing special gowns, hats and gloves to make sure that we are not at risk of contaminating the surgical site. During the surgery, Tiffany had a very stable anaesthetic, and Dr. Nima and her team were able to place surgical plates and screws into the fracture site in order to bring the bone ends together and make sure that they healed really well. They closed up the skin in a way that meant that we did not have to remove any stitches post-operatively, and that would reduce the risk of infection once Tiffany went back into her habitat. Throughout the procedure, Dr. Nima and her team repaired the surgical site, and myself and my anaesthetic nurse, Amy, made sure that Tiffany's anaesthetic was stable. We were able to provide antibiotics throughout the surgery and ensure that her pain relief was adequate. Tiffany's arm looked as though nothing had ever happened once Dr. Nima and her team were finished. It was incredible to see how well she had been repaired, and it meant that she could get back to her habitat within 24 hours of surgery. This was excellent news. Tiffany could rejoin her mob and she was relaxed and happy. But Tiffany still had a lot of healing to do, and it meant that we had to keep a very close eye on her to make sure that she did not develop any infections at the surgical site. After the surgery, we had to monitor her really closely for the next few weeks while she healed. And this was a big team effort. It involved Australasia watching her like a hawk. Every day, the keepers kept a really close eye on her and reported back if they had any concerns about Tiffany or how her arm was looking. I made sure to check in on Tiffany regularly, and every time I saw her, I could see a big improvement in her progress. She was doing really well, and she reached the point where she had healed completely.